Uh-oh. Here we go. So now we've got a case study. Y'all ready for this? These are the ones that everyone is, oh, I'm so scared of case studies. No, don't be. We've got a 3-month-old infant. So already I told you, if we've got a child that is given an age, 3 months, it's given for a reason, right? It's given for a reason. You think age matters? Sure does. It sure does. So now, this is, I'm gonna show you as we walk through all of these 6 types of questions. I want everyone to pay attention to how the boards are gonna ask this. Now, again, is this anything different? No. The approach is the content different? No, not at all. So again, we got an H and P. Why am I going to give you H and P? Because you should know how to read one. Because when I write one up and I hand it to you, or you write one up and you hand it to me, or vice versa, whatever it is, you better know how to interpret it. But now on the boards, what are we concerned about? How about the level of reading? That's my main thing. My main takeaway is, how fast can we read and still interpret? You can read all this and not interpret any of it. So we've got our general poem cardio, again, what did I say, head to toe. That's how I do my intakes. So now we go a 3-month-old infant. Evaluated for cyanosis. Okay, 3 months, cyanosis. The infant appeared bluish and pale during a feed this morning. The parents have noticed this color change during crying and feeding for the past few days. If I just gave you that general stuff, somebody, thank you. Yeah, it is tetralogy of Fallot, right? It's a tet spell. Have I taught you this? Or is this brand new information? I've taught you this, right? I've taught you this already. So with that, we're already one step ahead of the game, because again, we know that this is tetralogy. All right, so we will go on to pulmonary. Vital signs, respiratory rate 55, okay, SpO2 80. Well, why do you think they're blue? Lung sounds clear bilaterally. Okay, so we're not worried about any type of heart failure or anything that could be grunting or lethargy right now. We're looking at low O2, no retractions, nasal flaring, or grunting noted. And I didn't even finish reading the question, but I already told you there was no grunting. Vital signs, temperature good, pulse okay, BP okay, right arm, left arm, cool, left leg. Oh, so they did, see now, look at what they've done. Because I've never seen these questions before. Look at the vital signs that they've done. They did it not just in the right arm, left arm, they did it left leg and right leg. But bilateral pulses are equal and 2+. The infant is crying, and cyanosis is most prominent in the lips and tongue. We've got a single S1, S2 with a systolic murmur. What do we talk about murmurs? What was the mnemonic for tetralogy Fallot? Prove. Pulmonic stenosis, could that be a murmur? Okay. How about the VSD? Yeah. You see, all this stuff is all coming out. They're just wording it in a way that we would write in a chart, right? Or in the EHR. So now we've got no digital clubbing noted, cool capillary refill is less than 2 seconds. All right, not worried about it. Now we go to GI system. The parents state that infant tires easily and breathes faster during feeds. Whoa. What was the concept of tetralogy Fallot? Big feeds and being stressed out or crying. Do you remember that? Do you remember that? How has any of this changed? And you do the 4 S's, good. Yeah, So now the infant does not vomit with feeds, but occasionally spits up after feeds. What do you think in that one sentence they're trying to confuse you with? Pyloric stenosis. Yeah, it's not pyloric stenosis, but they're trying to confuse you. The spit up is non-bilious, non-bloody, and non-projectile, confirming that this is not pyloric stenosis. Abdomen is soft, non-tender, non-descended. The parents report to the infant or report that the infant has a bowel movement 1 or 2 times per week. Okay. And the infant is gaining appropriate weight. Cool. Let's move all the way down. GU. The parent reports infant voids clear, pale, yellow urine every 1 to 3 hours. Are we good with that? We sure are. So we've decided, just based off of general, forget everything else. Just based off of general, we decided that this was what? Or one of our differentials. How about our main differential? What's our main differential? Tetralogy of flow. Our main differential here is tetralogy of flow. Okay, so now click. Now this is where one type of a question that may show up. Click to highlight below 4 assessment findings, 4 that require immediate follow-up. All right, let's see. They will allow you, if you click on it, to, they'll allow you to click on what you think is most important. So let's go through all these. Okay, infant tires easily breathing faster during feeds. Infant does not vomit, spits up non-bilious. So if you notice, if I try to click on other things, it doesn't allow me to. But cyanosis is most prominent in the lips because there are, so I'm gonna use my finger instead of the Apple Pencil. So these are things that we're worried about, right? Vital signs. All right. R, SpO2, perfect. Cyanosis, yeah. Infant tires, yeah. And then we've got a systolic murmur. So if I was to look at 4 things that really concern me, SpO2, I'd probably be concerned about that. 80% for sure. TET spells. Cyanosis, TET spells. Systolic murmur, VSD. It's part of PROVE. Infant tires easily and breathes faster during feeds. Concept, feeding, and stress. So now, in a different way, I need to be able to highlight what is most important here. All right. So now we've already decided what we think this is. What type of a question is this? Does this change? This is part of a case study. It's a freebie. 100% it's a freebie. When I say diagnosis is a freebie, look, they threw, but Dr. Z, look at this. They got all this here. Oh my goodness. No, it's a freebie. We already decided this in the beginning. So what do we think this is? Tetralogy of flow? Yeah, because that's what we thought it was in the beginning. Bam. Move on. Done. Now, oh, wait a minute. Oh, but Dr. Z, no, this is a case study. What is this? It's straight up, it's risk factors, risk for which complications, select all the. Have we learned this? It's the same. Nothing has changed, right? It's literally nothing has changed. So let's see what can happen from tetralogy of flow. We start with thromboembolic events. Wait a minute. Can I have a thromboembolic event? Yeah, of course you can. Because if blood is not moving the way that it should, then blood stagnates. It's still a concept. Content is content. Infective endocarditis, if blood is not moving, are we concerned about it? Yeah. Then we can also get an infection. Same thing. Heart failure. Yeah, let my heart work. What's going to happen? It's going to fail. right? Failure to thrive, lethargy, grunting, failure to thrive. If my heart, chronic hypoxemia, well, if they are not getting proper, warm, red, oxygenated blood, are they going to become hypoxemic? Yeah, yeah. So we'll take a chance at that. I get, look, everyone's like, I get really scared when I choose all five. I get really scared, but it doesn't matter. When you know your content, you know your content. And this is your matrix. This is your matrix or grid, as they call it. So now let's look at what they're asking. Same thing. Do we use a method? Of course. For each potential intervention, click to specify the intervention that is indicated or not indicated for the care of this client. So we've got hypercyanotic patient, hypercyanotic episodes. So potential, give larger and less frequent meals. Larger, no, not indicated. Sorry, let me try and get this going. All right, there we go. Give larger, no. Less frequent, no. Smaller, frequent meals. I've talked about this. Encourage non-nutritive sucking with a pacifier. Why? Why do we do sucking with a pacifier? 4 S's. The 4 S's, yeah. I've taught this. Soothe, suck, skin to skin, right? We've talked about this. Offer comfort as soon as the infant starts to cry. Come on. Reposition the infant frequently throughout the night. Why would you wake them up? Why are you going to wake up a child? I don't even care if they got tetralogy flow. Do you want to wake up and deal with the crying child? Nope. We're good with that. Promote a quiet environment, especially in the mornings. Yeah, don't startle them. Wake them up slowly and calmly, right? What do you think? Is this really that hard? No, it's not. Let's see how we do. We got 2 more. Which action should the nurse take first? First initial priority urgent, most concerning, report to HCP. A nurse inserts a peripheral IV catheter. During the procedure, the infant starts to cry and becomes dyspneic and cyanotic. So what do I do first? Soothe the infant to stop crying, or place the infant in knee to chest position. Of the 2, which one do you choose? 3/4. Whoever says it just like that, that's exactly the mentality I want you to have. 3/4. That's it. Because do I want to soothe the infant? Sure. But I choose 3/4. Excellent job. Now I compare 3 to 2. Administer prescribed PRN oxygen via high flow nasal cannula or knee to chest. What do we say about people with that overriding aorta? What do we say about that overriding aorta? We said push that blood back, open up that aorta and let that warm, red, oxygenated blood go out. So I'm going to do knee to chest. Am I going to give them oxygen? Probably. Am I going to soothe them? Probably. But what am I going to do first? You see? But where have we learned this? We've already learned this. And give them morphine. Am I going to give them morphine? Or am I going to get that aorta open? What do you think? Now, all right. Last one, case study. Everyone's been tripping about this. There's nothing different about this than what I've already taught. There's nothing different about what I've taught already. All right, so now we've already determined it's tetralogy flow because we learned it. Content is content is content. Which of the following indicates, or which of the following findings indicate that the infant's condition has worsened? Worsened. The infant has been scheduled for surgical repair of tetralogy flow. So we start with poor weight gain. If they have poor weight gain, are we in trouble? Has this gotten worse? Because they're not eating. Does that sound poor weight gain? Does in general, forget about tetralogy of below. Doesn't that just sound bad in general? Yeah, it sure does. Periorbital edema. Whoa, where did we see that? Heart failure. Good. That sounds bad. Palpable thrill at the left sternal border. I'm not too sure that that's something I'm worried about, or it could have been just part of the right ventricular hypertrophy. It could be whatever. It doesn't mean that it's getting worse. How about no wet diapers in 6 hours? They're not peeing out, which means that we have low urine output, which means that that warm, red, oxygenated blood, is it going out? Low urine output. So we talk about diapers with children. Poor perfusion. Excellent job. Cyanotic lips and extremities when crying. Does that mean we're getting worse, or is that expected? And I love the word expected. Good. That's expected. Becomes diaphoretic and limp during feedings. Give me another word for exactly what number 1 is. Give me ass graph. Lethargy. Yeah, that's lethargy defined, right? So now, nurses, if we were to choose 1, 3, 5, 6, how do we feel about that? 1, 3, 5, 6. 1, 3, 5, and 6. What do we think? Anyone concerned about this? We got 4, 4. Was that the last one out of 6? We got 1 of 1. We got 5 out of 5. We got 5 out of 5. We got 1 out of 1. Look at this. Look. And 4 out of 4. Who's worried about April? This is just content. This is just content. As a matter of fact, I find these more fun. You know why I find them more fun? Because they're more real life. Like, don't ask me a yes or no question. Give me something I'm gonna see in real life. And those of you that know me, I always say, try me. Give me a whole H&P and let me diagnose this, because I want to know I can do this, right? So now we've got 4 out of 4. Boom. 1 out of 1. We got, I always get hesitant about these ones. 5 out of 5. We got 5 out of 5, 1 out of 1, 4 out of 4. We scored 100%. Going into April, everyone's been like, oh, April, oh, I'm so scared. Why?